My name is Simon Pearse. I'm a consultant cardiologist at Kingston and St George's Hospitals. I was always very interested in medicine. I come from a very medical family, so in some ways it was an automatic choice. It's never an automatic choice, but certainly I was exposed to lots of medicine early on in life. And the things that I really saw from seeing my family working and from researching about medicine is that it's the most fascinating combination of team working, of research, of academic work. It's very intellectually stimulating, and you know, you're helping people all day, every day. There's no greater privilege in the world than going out and helping your patients and making people get better or helping them through their difficult times. And that's really what drew me to medicine. And then I went off to medical school and loved the science of it, loved the physiology of it, started to get into the practical side of what being a doctor is all about. But I still wake up every day and just think there's very few privileges in life greater than going out there and helping people on a daily basis. So it's a wonderful job, and I'm very grateful I chose to go into it. So cardiology always appealed to me really from very early on in medical school. I sort of started off learning about the physiology of the heart and what an incredible organ the heart is, this little muscle that keeps you alive for the duration of your time on earth and beats millions of times, and the vast majority of cases very rarely goes wrong. So it's a wonderful piece of evolutionary engineering, and I love that from my early days in medical school. But then as you get later on in medical school, you start working as a doctor, you start to learn other things about the specialty, some of the practicalities of the specialty. I love the fact that it's a very fast moving, a very dynamic specialty. It's very research based. So we have an excellent evidence base in cardiology. So we can be really confident that we really are giving the best possible treatments for our patients and doing absolutely the right thing for our patients. I love the fact that it's very much a team working specialty where I work with specialist nurses, physiologists, radiographers, and as well as other doctors to really deliver the best possible care to my patients. I love the fact that in cardiology, there's so much you can do for the heart. The heart is a wonderful piece of engineering, and there's so much that we can do when it goes wrong to make it better, whether that's with the fantastic array of medications we have for treating the variety of conditions for the heart, whether that's things like pacemakers, whether that's with stents, or even whether that's with surgery for the heart. There are so many things that we can do to fix the heart or make it better when things start to go wrong. And I love the sort of hands-on aspect of working with the heart as well. And it's a hugely satisfying area of medicine to work in. So yeah, certainly have no regrets about going into cardiology. It's a real privilege to work in the specialty. I think working as a consultant cardiologist is a hugely rewarding thing. The things that I would perhaps highlight are that I love working as part of a team. So managing heart disease is very multidisciplinary. There's the doctors like me and my more junior colleagues. There's the specialist nurses, there's the physiologists, there's the cardiac investigations teams, and there's the allied health professionals that we work with as well. So to really deliver the best possible care for the heart, perhaps as much, if not more than any other part of the body, you really need this multidisciplinary approach, and working as part of that and bringing the most out of your team is hugely rewarding and hugely satisfying, and I think it delivers the best possible care to your patients. On top of that, I love being able to spend time with my patients. A lot of the conditions I treat, for example, the heart failure patients that I manage, it's quite a long-term condition, and you know, I will be their consultant for over a period of several years, and building those therapeutic relationships with my patients and getting to know my patients and really making sure that we're giving the best possible holistic care, not just prescribing medicines and doing interventions, but making sure we're doing everything we can to make sure the quality of life is good for patients. Is a hugely rewarding thing to be involved in, and it's just so satisfying that there's so much we can do for patients and so much that makes them better. It's wonderful when a patient comes back to you and says, yes, I feel better, and that's something that continues to inspire me.